I'm Carol Schumacher, and before I ask the question, I'll give you my background. I'm a veterinary nurse. I own a veterinary hospital, and we see in dogs a lot of mast cell disease. And I just know from my experience that they all go on steroids. And I wonder if there's a relationship, and maybe that's why MS patients respond so well to steroids.
It's possible. Is it working? Okay. Can you guys hear me? Oh, there it goes. It is possible. There's a couple of new medications, too, I saw, and I wish I could remember the name, but they put a patch. Actually, they removed the tumor and put a patch over it, and that seems to be more successful even than steroids. I was on a low-dose steroid and got, a hint of an effect, nowhere near as good as actually hitting the mast cells directly, nowhere near as good. But a lot of us are on very low-dose steroids. But I could look that up. I saved that because the animals get so much more attention than we do sometimes, and they are very prone to mast cell tumors. Mm-hmm.
Okay. Any other questions? So the last part of the session would be discussion between panel members and participants. So if you have some questions, comments not related to the last lecture, please. Are there any comments? So maybe I summarize the session. These eye issues seems to be very interesting in terms of CSV-IMS correlation, especially because it is these optic problems in MS patients are somewhat contrary to the commonly ruling autoimmune paradigm, because it is assumed that multiple sclerosis is primarily driven through immune response against myelin. But optic nerves contains mostly unmyelinated fibers, so it is somewhat against this problem, which is also known in the cases with optic neuritis. Not all nervous fibers are lost, but preferentially these small diameters axons are preferentially injured. And what is known from animal experiments, the condition which preferentially injures these small diameter axons in optic nerves is ischemia. So perhaps it's just this mechanism drives this injury in this particular territory. Any other questions, comments? If not, thank you very much. And please join. Yes?
I was wondering, Diana, what particular mast cell treatment you were talking about?
Found very effective H1 and H2 antagonists, which are over-the-counter, something like Zantac and Zyrtec. We take double doses of it. And then the mast cell stabilizers, which is really important, it just calms them. Sodium cromolyn, or cromolyn sodium in the States, ketotifen outside the United States and Canada, et cetera, is just as effective. And my son, for example, was disabled by this for 3 years. He was unable to go to school from the age of 10 to 13. He was too ill even to be tutored. 2 weeks on mast cell medications, interrupting that inflammatory cytokine process. He's back in school in 2 weeks. And we're continuing working with him because he needs more focused medications for inflammatory cytokines. We've got to get those under control. And he also has a compressed vagus nerve. So we have to look into that too. Thank you.
Okay, another comments. So tomorrow we start at 8:30 with a very exciting, I think, session related to clinical trials in CSVI MS patients. So please come, enjoy.